Hi, I'm Paula Rowland, and I'm a fellow with the AMS Phoenix Project from the 2013 cohort. I'm also an occupational therapist by background, and what I valued most about my practice as a therapist was this opportunity to be working with people as they were trying to figure out the job of living after experiencing an illness or an injury. And I was always struck by the privilege of being with people in those moments, and also what it meant for me to be working with people as they're figuring out how to restore their lives after this illness or injury, and what it meant for me to be there with them for both my practice as a professional, but also who it meant for me to be as a person engaged with them that way. When I heard about the fellowship, what I really wanted to do was be able to pay attention to the relationships between individuals and organizations. And so as a fellow, I have the opportunity to collaborate with University Health Network, and together we're having a really deep, thoughtful look at how we talk about and think about patient engagement. So patient engagement, the idea behind it is that in working with patients, working with patient advisors, that we can design health systems that are more compassionate, more patient-centered. And then so looking at it and using the skills that I have as a researcher to really pay attention to, well, how do we do this? Who do we mean by patient? How do we invite someone? Where do we find them? How do we ask questions about what are we asking people to do in these moments of engagement together? That's what I'm able to bring my research training for. And so what I'm finding by doing this kind of research is that this is enormously complex. This is a very strong social innovation that we're talking about. And in using the research to be able to talk about these kind of complexities, then we can have better conversations with the practitioners, with the patients, with the policymakers who are making decisions that make patient engagement possible. I think about one of the women I met through my opportunity to interview patient advisors. And this is a woman who has an illness, who genuinely wakes up every day not sure if it's her last. And she chose on that particular day to come talk to me, to do an interview with me, on this hope that part of what she talks about, what she says, will make a difference for how we engage in care in healthcare systems. And so when I think about the research that I'm doing, and I think about the care that we're providing in organizations, I want her decision to matter. I want it to be that the kind of privilege that she gave us by coming to talk to me that day, by coming to participate in committees, by filling out the surveys, by coming to the focus groups, that it matters, and that we do well by her and the kind of decisions that she's making to engage with us.